Private practice payer source number 3, Medicare. Let's talk about Medicare and how it works in private practice. Medicare is a federal health insurance program for people over 65 and certain younger people with certain kinds of disabilities. Private practitioners who want to work with Medicare-eligible adults must become a Medicare provider and bill through Medicare. Katie Brown, a private practitioner in Buffalo, New York, has found great success in her adult-only private practice, and Medicare is her primary billing source. She provides evidence-based, holistic, and person-centered care for adults with a variety of strokes and brain injuries. Medicare tends to pay pretty well and on time and is a great solution for private practitioners who want to serve adults like Katie. In the Start Your Private Practice program, we have a Medicare tutorial in Module 4, which is all about billing made easy. Want more information about private practice? First, make sure that you're subscribed and that your notifications are on. Also, check out the links below this video for more free resources to help you get started.